My name is Cole Beeler, Colebeeler. I'm an infectious disease physician and medical director of infection prevention at Indiana University Hospital. In 2023, we expect ongoing high transmission of influenza, COVID, and RSV, as well as many other respiratory viruses. Each of these viruses has a different predilection for long-term side effects, and because of that, it's still very uncertain on how these viruses are going to affect our health system, our hospitals, our emergency rooms, and the clinics. Winter weather conditions increases the spread of respiratory infections in a number of different ways. The first and probably most evidence-based is the fact that when it's cold outside, people cluster together indoors, and because of that, that favors transmission of respiratory viruses. Second, what I would say is that dry air in the winter season, or air with low relative humidity, favors transmission of respiratory viruses. And last, something we're learning a little bit more about more recently is that cold weather probably affects your body's ability to protect itself against getting infected in the first place. In 2023, in order to protect yourself from respiratory viruses, the best thing you can do is just avoid close contact with large groups of people who may or may not be infected. Certainly avoiding people who you know are infected. And if you have to be around large groups of people or maybe are at risk for side effects of viral infection, then wearing a mask is probably the most potent protection that we know of. In addition to that, getting vaccinated for diseases that are vaccine preventable, not just influenza and COVID, but also pneumonia bacteria is also prudent if you already haven't gotten it. Washing your hands and making sure that you're practicing good hygiene, maintaining a healthy diet is important. And then lastly, what I would say is that if you're sick, you can protect the people around you by staying home if you're ill.